So again, thank you both for joining us today at this wonderful event, Unlocking Insights, the Emotional Dimensions of Urinary Incontinence. We welcome you. So our first today will be our first questions today. We'll go to Dr. Michael Cohn. Welcome, Michael. How are you today?
Thank you. I'm very well today. I'm looking forward to this. Thank you for introducing me, and welcome to the webinar.
Thank you. All
Looking
right,
forward to this.
Michael.
Looking forward. Yes.
Thank you. So our first section today is going to be for both Michael and for Julie to discuss different aspects of understanding urinary incontinence. And first, Michael, we're going to have you go through for us a brief overview of urinary incontinence and its complications.
Okay. In order to understand the complications, I have to, in a simplistic way, try to describe for you how this controlled mechanism of voiding or excreting the toxic substance urine from the body is happening. And then from that, we can go on to see what is going wrong and what are the consequences. So I'll try to keep it as simple as possible. But as I said, the kidneys excrete continuously the urine into the bladder. And the bladder is actually a muscle, and it's also controlled by the autonomous system, something we can't control ourselves. When the bladder is gradually filling up with urine, it stretches a little, and in the brainstem, we call it the pons area, it starts to register that we soon need to void, that we need to get rid of it. It's going to fill up. And while the bladder stretches more, the nerve sends out more signals that now may cause contractions of the bladder, and we really feel an urge to soon void. This is all happens involuntarily. It's called the autonomous nerve systems. However, the urethra connecting the bladder to the outer world, where the urine has to pass, is surrounded by a pelvic muscle, or we call it a sphincter, and that is in a default mode is closed and it holds back the urine. So when we come to the bathroom and want to void, the sphincter muscle voluntarily relaxes, allowing the voiding of urine. So here we have a delicate balance of involuntarily contractions and sensations and a muscle sphincter to resist that pressure caused by the contractions. That is a very simple way of explaining it. As you may understand, many things can go wrong in this system, and they do for many of us, for many different reasons, and we'll go through some of them here in the seminar. But it can be due to normal life cycle events like age, menopause, giving vaginal birth, or due to lifestyle and some diseases. So we'll go through some of them here to see what can be. So with the age, the wall of the bladder gets a little stiffer, and we may feel that urge sooner and stronger than when we were younger and had better elasticity, especially when the beard goes gray like this. Is something happens to both men and female. These sudden contractions that sometimes causes leaks are called urge, and quite normally also with age you sometimes call them threshold incontinence. You need to go to the bathroom, you feel that quick urge. But it can also be exacerbated by diabetes or neurological diseases like MS, and in men it can appear due to an enlarged prostate. With age, we also produce more urine at night, and we have to get up more often to void. And that's why nighttime incontinence or nocturia and eresis when we leak at night is a common problem, also at an older age. And there are some side effects that we have to go up very quickly at night, and we lose our blood pressure, or the blood pressure drops, and we can fall, and it can lead to hospitalization. Another way, if you have, so these are the urges and happening automatic, but there can also be a problem with the sphincter. Let's say you're coughing or you're training and you're increasing the abdominal pressure, you're putting external pressure onto the bladder, and and you can cause a leakage. The sphincter can actually not hold against that pressure. It can be an external pressure. It can also be the contraction of the bladder. But in the case of abdominal pressure, and you have incontinence from that, we call that stress incontinence. Can also happen in obesity when the tonus and the tone of the muscle changes, or sometimes with post-vaginal birth, where you didn't rehabilitate after giving birth, and you need to activate the muscles and train them afterwards. And then you can, at quite an early age, get stress incontinence symptoms. And the pelvic wall then is weakened and damaged, and I think Julie can speak more about that. Neurological damage due to MS, stroke, and dementia also affects the central nervous system and its pathways, controlling, voiding both the voluntarily and involuntarily, as I explained. And in serious neurological disorders, where spinal lesion or MS, the muscle sphincter cannot relax, and then you actually have urine retention. You cannot void at all, and after some time, the bladder gets really very extended, and you get overflow incontinence, you call it. So in order to manage that, you actually need to put a catheter in and empty the bladder mechanically in order to control that, or have it at an indwelling catheter. If you combine, and in order to manage that, you might want to combine a catheter and an external device at night to control the nighttime leakage. A combination of these conditions, the neurological, where you basically have contractions and you cannot hold the urine at all because of sphincter dysfunction, is called mixed urine incontinence. And that leads to constant leakage, and usually it's worse at nighttime, and needs management in order to manage that with different ways of collecting urine. We can also see that after radical prostate operation, prostatectomies, due often to prostate cancer, they can have similar symptoms. So this was a very overview on like the mechanisms of the neurological and the mechanical sphincter functions. On the side effects, that's part of the question, I understand, Christy. From urinary incontinence, we have to understand that, first of all, urine is a toxic substance. We don't want it on the skin. We have to get it away from the body. And that's due to the high pH, which is urine is a basic system, and our skin actually likes slightly acidic environment. So the urine ruins the skin barrier, and it causes inflammation, redness, and ultimately wounds if it's not cared for after prolonged contact with the skin. We also see, as a side effect of urine incontinence, often urinary tract infections. It's also often associated with incontinence, and can also be due to hormonal factors, a vulnerable urethra that doesn't close properly, and also the treatment with adult diaper, which you can have contamination inside an E. coli, and that might make you more vulnerable for urinary tract infection. So you can actually attribute some of the side effects not to the actual incontinence, but to the treatment. So we can separate that also. But there are other side effects which are basically social and psychological, because there's a lot of stigma being incontinent, and that changes our behavior, and that can cause other side effects. So the fear of smell and the embarrassment of wetting yourself, maybe the sexual function will be impaired. You don't feel that closeness, and you have a hard time relating to your partner because of your fear of incontinence, and that can lead to depressions. Very common, isolation, depression. And another side effect, on your caretaker, your partner, have maybe to take care of you and help you, or your children. And these are also kind of other side effects you can have from incontinence. And another strategy because of urine incontinence is that you decrease the intake of fluid because you don't want to load the bladder, and can lead to dehydration and a lower blood pressure, and you might fall. You go up in the night, you fall and you can break a bone, and you get into the hospital. And these strategies which we have to sort of isolate ourselves and decrease intake of fluid actually worsens the prognosis. So this is very important that we understand why we have it, how we can deal with it. Is there an underlying cause that we need to deal with that? So that's very, very important. Yeah, I think that's a quick one.
Thank you so much for that overview of urinary incontinence, its complications, its valuable insights on a complicated problem. Next question for you, Michael. How significant actually is the problem of urinary incontinence on public health? And are there any demographic groups that are particularly more affected that you'd like to discuss?
Thank you, Chrissy. Yeah, this is very interesting. I mean, this is something we don't talk a lot about, but a common number is that about 5 or 10% of the population globally, we don't know because people don't speak about it, and the numbers come out a little differently depending who you talk to, are believed to suffer from incontinence. I've seen numbers between 2 and 300 million people globally. That's more than US population total suffering from incontinence. And at younger age, it's about up to 6 times more common in women. At an older age, it becomes a little more equal, but it's very commonly women that are encountered in the healthcare system with incontinence. Later with men, it's more due to the prostate. So in the US, about 32% of all women report symptoms monthly. That's 1/3. And 22%, about 28 million women report more severe incontinence. So basically, it's all around us. It's all over the place, and we really don't talk about it, considering that about a quarter of the population really suffers from it. And there's a cost to it. It affects you in other ways. On the personal level, we talk about $20 billion costing for pads, operations, insurance fees, and so on. This is in the US only. And we're talking Europe, it's the same number, and Asia and South America. So globally, this is a huge problem. And costing for the society, we're talking about longer stays in the hospital because of incontinence, infections, caretakers having maybe to stay out of work to take care of your mother, take care of your father, and so on and so forth. You talk 10 times $200 billion cost. And there's also cost. So, I mean, looking for insurance policies to cover solutions with Medicare Part B becomes very important for the individual. And if we talk about risk factors here, so age we spoke a little about, but it's not all. Obesity, a BMI over 25 is another risk factor. Of course, prior vaginal birth, we spoke about that if you don't rehabilitate properly with training. Anxiety can be caused by depression, but it can sometimes also be a reason for depression. Of course, you have other things like diabetes or neurological MS and other neurological diseases that can affect this, of course. But interesting, we see that non-Hispanic whites have a higher incidence and prevalence of incontinence than if reported from Black, Asians, or Hispanics. We can discuss later why that is, why we think that is. There is no really clear answer. And of course, you have an age related here. From age 70, you have about almost like 50% or more. So it is everywhere, and it should be examined why and noted and considered in any care situation. Definitely. Thank you.
Thank you so much. That's a great overview, and you really highlighted with some astounding numbers the significance and the impact of urinary incontinence on public health. Plus, you gave us a great segue to introduce Julie. Julie, thank you so much for joining us today. Welcome.
Hi, thanks
First,
so much for having me.
absolutely. So we built that foundational physiologic understanding of urinary incontinence. We're going to build on that psychological impact. Can you tell us, how does urinary incontinence affect a woman's emotional and psychological well-being?
Yeah, so it is a huge problem. As women, we are taught to look beautiful and be this whole person and be what everybody else wants. And then here we are. If we are affected by urinary incontinence, there is the shame, the embarrassment, the social stigma of it. Um, it creates so much psychological distress as women are feeling judged and ridiculed. I mean, how many jokes are there about that? And I think there is also a problem in that women are social creatures, and yet this is something that we do not share and we do not discuss. So we sit here in isolation thinking that we are the only ones suffering from it, and it's embarrassing and it's humiliating, and that self-imposed isolation will then lead us towards anxiety and depression. I mean, women will be and just in general, incontinence, the the potential for urine leakage in public will increase your anxiety, and then suddenly you start looking, where is the bathroom at, you have to worry about everywhere you go. Are you going to have access to a bathroom? And then you're going to see people start limiting their activities and such just because they are going to potentially be in an unfamiliar surrounding and situation, and then they're not going to know where the bathroom is. And that creates so much distress within a person. And then from there, the social withdrawal just because they have a fear of leakage, and it then will start impacting the quality of their life as they start uh, retreating from social activities. And then it creates problems within relationships because suddenly you are not going to be able to be that person that you were once before, solely because you are so concerned about the incontinence. And then it is going to impact sexual health, because how can you feel as if you want to participate in sexual activities if you're constantly concerned about leaking urine with your partner? So this will then further create lower self-esteem and low self-image and just decrease your confidence, and it is just going to impact your professional life. I mean, how are you going to hold a job if you need to go to the bathroom every 15 minutes due to a situation within your bladder, whether it's any number of potential diseases? And then, here we are, we know, as an occupational therapist, as a pelvic floor therapist, we are taught how sex is an ADL, an activity of daily living. So you're not able to participate in that. You are having trouble with your toileting because you need to be able to get to the bathroom. You suddenly have to change how you're dressing because you need to have that easy access in order to get to the bathroom in time. People are going, just like Dr. Cohen said about limiting your fluid intake, people are going to be watching what they're eating and drinking. And then it's just going to impact the person as a whole and just create so much distress. And it's sort of just like he was saying, that situation, what's coming first, the incontinence or the anxiety, depression, we don't, it all sort of just blends together and becomes a huge problem for a person. And we keep hearing that this is normal. People will say that it's normal, but it's not. It's a common thing, but people don't discuss it and they're not told about it. So therefore it just becomes isolating, and everything that I just said, you're just going to suffer as a person.
Thank you so much for sharing generously. You're really helping to shape the true physiologic and psychological impact. Let's build on what you shared. Can you give some insights into the social stigma associated with urinary incontinence and how it affects the seeking of treatments by women who experience urinary incontinence?
Yeah, so um, there are a lot of delays in seeking of help for it. Um, you know, Usually a lot of times somebody is not going to actually mention it to their provider until it is possibly a huge problem. And as was said, they're getting the UTIs and everything else, but there were steps along the way that could have been taken in order to prevent it from having gotten to the extreme case that it had become. Just the idea of discussing it when people feel so lonely and isolated, it's very hard to address. And their conversations are just not being had, whether it's from the medical side or the patient side, or just as people in general. We're not addressing the fact that this is unfortunately a common um, situation that can occur to someone based on a myriad of reasons. And therefore, we're not, they're not asking for help. They are potentially not even reporting. I mean, Dr. Cohen said that it largely, or more so, is affecting Caucasian women. However, what if the other women, whether they're Black, Hispanic, Asian, anything along those lines, what if they are just not reporting it? Um, and not just that, there could be a cultural or a religious divide that does not allow a person to discuss it. Um, they may not be fully disclosing the extent of their incontinence solely because they are so ashamed and embarrassed about what is happening to their body. And since they don't know that other people are experiencing the same problems and symptoms, they're going to think that they're alone. So they're not going to do it because of that that negative social stigma. And then, they may be trying to manage it on their own. And that is wonderful, but there could have been steps along the way that as professionals we can introduce them to. There are some amazing devices that are coming out that we can utilize in order to help patients, help women um, work towards decreasing the incontinence and possibly even preventing it if we can take the steps early on. So, and the other thing too is uh, when somebody is self-managing and they are self-paying for their products, such as the adult diapers, which I truly hate that term diaper, but that's besides the point. But using those incontinence briefs or the pads, and all of these things just begin to create such an expense. So then a person may start using them and wearing them well past the wear time or wear date that they should, in the sense that the pad may be completely filled, but they're going to keep using it because it is too expensive to continually use more. And that's when we're seeing more and more problems. So it truly is, it begins with a social stigma, and then it affects the whole person, and it can affect them not just monetarily, not just socially, but just in terms of their own global level and global world.